This video is very disturbing. Any medical professional watching this video knows this is a hoax. This is all a military operation. That's a military plane. All of these men are military. Everything about this is military. Since when are military experts on taking care of infectious diseases and sick patients? What's the military doing all over this patient? But there's not even a patient in that chamber. That isolation chamber. Look at the guy saluting right there in front of you. He's saluting an ambulance. After this is all over, you'll see the guy in white, one of the guys in white, you'll see him debriefing the guys in orange. There's an IV bag hanging outside. The IV, it's hanging to gravity. Since when do you not use a pump? Look at, there's equipment laying across what is supposed to be a patient. The patient never moves. There are so many things irregular about this video. It is incredible. A media circus, when usually sick people arrive on a jet, there's no media circus. They want you to know Ebola has arrived. Those are military pilots wearing military flight uniforms, and they don't even have a mask on. That should tell you something right there. What in the hell's going on? Ebola's been around for millions of years, and now you're watching a two-man transfer in a heavy device with a patient inside the heavy device, and you do a two-man transfer out of an airplane. You go all that way to get a critically ill patient, and then you risk it all on a two-man transfer. We've all been transferred in the hospital that have been in the hospital with just a sheet, and they use 4 people, don't they? 5 people. That is crazy. There's nobody in that. There's nobody in there. You don't see a head. You don't see arms. You need to access a port with that hanging IV to gravity. But that equipment, we try to identify it. It looks like an IV pump and a clamp. And we'll try to zoom in and show you. Look at the guy in the background with his hands up by his face. What kind of body language is that? Oh my, this looks like a freaking presidential escort. They want you to know. And why are we using CIA and Air Force planes to evacuate the sick? Why not a true jet that's a ambulance, an air ambulance? Oh my goodness, people, there's nothing right about this. If you're hanging an IV to gravity, you need to be able to see if that is dripping. And you don't see an arm anywhere in there, do you? There's nothing normal about this. A two-man transfer out of an airplane. Oh my goodness. They don't even do that with a sheet transfer or a simple stretcher for a critically ill patient. That's not a critically ill. Here's the guy saluting. Oh my goodness, a guy saluting the ambulance. This is crazy, people. This is just crazy. I can't believe they would pull this off. This video was released by the Ministry of Defense. There's the insignia in the upper left-hand corner. Why are they producing videos now? This is a black ops. This is sickening. This is absolutely ridiculous. These guys don't know what they're doing. They have no clue what they're doing. You know, at least you would put 2 guys at the head. You don't want to drop the head, do you? You don't want to drop anything. That's a huge risk. Somebody who's going to bleed internally, and you do a 2-man transfer. An IV hanging outside the isolation chamber. That means there's an open route going through into the patient somewhere. And you could easily hang this bag on the inside. There's hooks everywhere. And look at inside this square. You see like a green capsule or something. That looks like an infusion chamber. I can't guarantee it. I can't swear by it. But it sure looks suspicious. And lower on the patient, looks like a clamp. Again, it's very subjective, but this is equipment laying on a body, which is ridiculous. I can't believe what I'm seeing. This is sickening. This is absolutely a hoax. They're trying to force you into a dark agenda. And the CDC saying it's airborne. I mean, come on, if it was airborne, there'd be millions and millions of people dead from airborne Ebola. This thing would be a mess. This is crazy. Everything about this Ebola is a media circus. Why would they dump bodies in the streets just so they can be photographed and scare you? Oh my goodness, there's so much going on. New York is trying to pass a law saying if you don't take a vaccination, they can quarantine you indefinitely even if you don't have symptoms. Nothing about this seems normal. The flight crew not wearing a mask, 2-person transfer, not even coming out head first. I mean, this is just a hoax. The military, you can tell they're not very good at medicine, are they? They can't even take care of their own veterans. Why isn't there an air ambulance? Why aren't there real medical people here? Why is it all military? There's a guy saluting right there. The guy on the left with the white. Saluting an ambulance. These are all military. It's a military air base. It's a military Air Force jet. You got an IV outside the containment vessel. With equipment laying across the body. You don't even lay equipment across healthy people, much less somebody who's hemorrhaging internally. Nothing. These guys have no clue what they're doing. It's Laurel and Hardy. And look at the guy in the background debriefing the guys in orange, his hands up by his face, waving up by his mouth and face. Wonder what that body language means. And since when do we have media circuses for patients who land? Oh, when they really want you to be afraid of Ebola. That's why. The CDC has not once talked to you about gamma globulin, and that's a drug they use for rabies and hepatitis C and hepatitis A. And instead, they talk about a possible vaccine. They want you to get the vaccine. I can't tell you, when you're in a hospital, when you've been in a hospital, has anybody ever transferred you with a 2-man transfer? If they have, that was against protocol. You've got to help me get this video out. You have to forward this to as many people as you can as soon as you see this video. It doesn't make sense that they would release and weaponize Ebola. It doesn't make sense on the depopulation because then they are at risk. And yes, some of them think that the old blood supply is resistant to Ebola, but my goodness, not everybody in the elites have type O. So this would be a high risk for them to pull us out, but they sure can wag the dog. They can make up as many sick people as they want. And these Air Force people, they weren't too afraid of Ebola. They weren't even wearing a damn mask. This is totally sickening. This is like the worst hoax I've ever seen. This is poorly done. They should have got at least people with sound critical care experience. An IV hanging outside the infusion chamber. They have hooks on the inside. You can hang them on the inside. You have a pump. You don't need it to gravity. And yet, there we see our guy saluting an ambulance. This is all military. The patient that came to the United States came on a CIA jet. What does the military have to do with treating sick people? Where are the specialists? Where are the infectious disease guys and the internal medicine guys? No, it's all military. This is very, very disturbing. The motorcade looks like the presidential motorcade. They want you to know Ebola has arrived so you can be afraid. A close-up shows you equipment laying across this. There's not even a body in there. Look at the crimp at the bottom of the mat. The whole thing slid towards the foot, and nobody straightened it out. The patient's not moving. There's no arms, no legs, no head, nothing. Look how thin it is. You think two men could take this out of an airplane with a patient in the isolation chamber? No, they were just lifting an isolation chamber by themselves. These things are very heavy. Look how heavy it is. They're moving it like a trunk. They're moving equipment. They're not moving a critically ill patient. That was the most riskiest thing. You fly all this way, and then you transfer a patient out of the plane like that. That is a high-risk transfer. And there's so much in this video that is disturbing. It's a hoax. I mean, why would somebody bring Ebola to their territory? Why? That's unprecedented when you take a patient to the medicine instead of the medicine to the patient when they're on the verge of dying. These are military because you will see that, I'll point it out so you won't miss it. There's a guy salutes an ambulance. Give me a break. Here comes the ambulance. Look at the guy on the left. He's saluting. He just saluted an ambulance. And, I mean, this thing weighs a ton. And you don't see anybody move. The IV bag should be attached to the pump, should be inside the chamber. Otherwise, you have to have an opening in the isolation tube for that tube to run through. That makes no sense. They have plastic bubbles you put your hands in. You can do all the work through this plastic bubbles you put your hands through. You don't need to have an IV bag hanging outside of the isolation chamber. So, I don't even believe there's a patient in here. You know how heavy that chamber would be? Barely two guys can lift it now. Why would you go all that trouble to bring a critically ill patient to your country? Why would you do that? And then have a two-man transfer out of the plane. That was very poorly done. And anybody who's in medicine will chime in. The guy saluting. And then when it's all done and over, one of the guys in white goes over and debriefs the guys in orange. And you can see him right now almost pointing towards the terminal. Right there with his right hand, you can see the glove sticking out. And then look at his hand body language up by his face at the end. This is an amazing video. He's debriefing those guys there. He's telling them exactly what to say and what not to say. And the body language of the guys